Typically, a patient will come in for a consultation and we'll talk about what their expectations are. We'll talk about what, if anything, they've been doing to help with their hair. And we can talk about various therapies, whether that be platelet-rich plasma, whether that be some home therapies that we have, or of course, whether they benefit from having a transplant. So I examine the patient to see whether or not they're a good candidate for the procedure and want to make sure that they have good donor hair in the back and that they have enough loss that they would benefit from getting a transplant. The procedure is very easy. Most of the patients just sleep through about half of it, and we stop, have a little lunch, and then finish up in the afternoon. Most guys tolerate it really well. At first it's very short, but it grows to normal length, and patients can style it any way that they want, just like their regular hair when they were younger.